a surgery last Tuesday. Today has been Thursday. So, it's been over a week now. It was a big one. Wound up taking 15 hours. They replaced all of my blood, which is very dramatic. I basically lost all of the old stuff and got however many units of new stuff during it. It used to be before surgeries. This is sort of happened last time I had surgery too. It used to be they would make me sign off saying that I would accept blood products if necessary. But now it's kind of a given that I will be wanting some new blood once I go in, because it's how I like it. So I always get nice new set of blood out of it. But this time they wound up doing something weird. Surgery was to cut out some bony tumor on the left side of my skull there. And in the sealing up process, they cut up my trapezius muscle, folded it up to make a flap covering where the bone was missing, sort of, until they can get a metal plate put in that'll sort of protect my superpowered brain from injury, which is nice. And it's very weird because the muscle doesn't know that it's been folded up to the back of my head. And so when I just move my head normally, I have the sensation of something. I feel like a broken umbrella. Like I feel like a ragtop convertible hood is swinging up somewhere. Not quite right. But that should probably go in time. That'll be fun. As you may have detected, I lost some movement on the left side of my face. The eyebrow and eyelid, of course, don't move as freely as normally. The eyelid can still shut, which is good, but not very well, which is bad. And the mouth doesn't really open very much. This happened to a lesser extent last year before I needed surgery, just because the nerve was getting pinched, and I discovered that if something exciting happens, I can cover up my sort of expressive right side, and no one will ever know what's going on with just my left side, so I'm going to get some kind of phantom mask and be a very enigmatic guy from now on. But this time they went in, and the nerve was just apparently fried completely, and according to my otorhinolaryngologist, who's one of the head surgeons who handles my surgeries, it was brown, which is not the desired color for that particular nerve. But yeah, you can sort of see the action on the back from the trapezius. They want to do a relatively short follow-up surgery next week, and so they are leaving a system of staples and stuff in my head and back for now, which is okay if necessary, although I won't mind having them finally out. The big adjustment's been sort of adjusting to eating, where food sort of accumulates on one side of my mouth, and the tongue and jaw don't work quite the way they're supposed to. And so, choke a little bit, not good. Have trouble swallowing, have to drink with a straw, and that's cool. And so adjusting to that, and this eye sort of never quite closing all the way has also been a bit of an adjustment, but as has been displayed, I can still make very engaging discursive speeches. I'm sort of banged up a bit. I don't know how well the lighting shows it off, but I'm a bit bruisey in general over my body. I think when they took the trapezius up, they sort of just cut out a lot of other muscles, probably for other cancer patients to use in their flaps, just because I am sure that I used to have rather a lot, and now it's sort of a more economic set of musculature found on me. It's unfortunate. That's the main stuff, I think. Let me cut that out. Nerve. A lot of treatment. And so this ear still sticks out a little ways, but it's definitely much less bad than it had been. And I'm believe that I'm closer looking symmetric again, although I could be flattering myself. It's hard to say. I had thought for a while, it seemed like this ear was sort of filled up with like a plug of dried blood or something. This ear had been deaf and they lost the inner ear in a surgery last year, a very long time ago now. And I thought that it seemed like there was a stitch in there, and so I knew they were going to take that out. And I finally figured out today what happened was the stitch and the dried blood and the weird leaking fluid and all the fun stuff, like everything else on my body, the ear sort of leaks a clear red fluid throughout the night. That's fun. It's actually been walled over, and so there's no longer like an ear hole like you're used to, or for tiny spaceships to fly into my head with. It's been sort of sewn over, so that's cool. I guess keeps the rain out and stuff. Hopefully I won't have phantom ear hole disorder or whatever, but that's sort of the state of the union now.